When you have one or more of the following symptoms described in one of your questions, think Ehlers-Danlos. This would be joint hypermobility or even laxity. Sometimes the patient will present with multiple joint dislocations in the past, skin hyperextensibility. Usually the skin can stretch more than 4 centimeters, and tissue fragility, which leads to easy bruising and spontaneous organ rupture as well. Lastly, poor wound healing. You often have patients with cigarette paper-like scars on their skin, and ultimately this is because the patient has a genetic disorder, Ehlers-Danlos, which causes impaired synthesis or processing of the connective tissue inside the body. This means your collagen or your extracellular matrix is not being built properly. Now, during step 2 and even step 1 now, they already know that you can probably figure out the diagnosis just based off this criteria alone, but what they really like to test are the clinical features of Ehlers-Danlos and Marfan in comparison to one another. So let's start with the skin. In Marfan, what you really only see is striae versus classic Ehlers-Danlos. Again, you have that atrophy, that scarring, easy bruising, poor healing, and sometimes their skin can even look transparent when you stretch it. When it comes to musculoskeletal clinical features for Marfan or classic Ehlers-Danlos, they all have this in common. They all have joint hypermobility, they have that pectus excavatum, they can have scoliosis, but patients with Ehlers-Danlos can have high arch palates, and Marfan, they're usually very tall and they have very long extremities. Now, cardiac, both Ehlers-Danlos and Marfan are associated with mitral valve prolapse, but it's Marfan that has aortic root dilation. Some very high yield clinical presentations with people with Ehlers-Danlos, they have abdominal or inguinal hernias, or they even have uterine prolapse, versus Marfan's, they have lens and retinal detachment and spontaneous pneumothorax. Both are autosomal dominant, but Ehlers-Danlos has a collagen mutation, COL mutation, and Marfan is FBN, which is fibrillin.